Now we have this session, which is on the Swedish-Indian life science partnerships, a key to innovative, sustainable, and equitable green transitions. I'd love to present Maria Helling, the CEO of Swecare. And Maria, you have been with Swecare for many, many years and led many delegations to India. So I would also like to call you an Indophile because it's a country that Swecare, I think, has really invested in terms of developing partnerships within this sector. So it's gives me great pleasure to welcome you here, and leave it to you to introduce your speakers. Thank you.
I think we'll start with just a film to set the scene. Well, there, I think you got a little bit of an idea of what to expect from this session. I must thank you for the very kind words in introducing me. I'm very happy to be here for this session, and I'm thrilled for the discussion that we're going to have here. It is true that we have worked with India for many years. Swecare, just to give you a brief introduction to the organization that I represent. Swecare is an organization under the Swedish Ministry of Health and Social Affairs, and our mission is to work for export and internationalization of the Swedish life science and healthcare sectors. And we do so together with our members. We're around, I think, 120 members of Swecare today, mainly companies, but also organizations and the Swedish university hospitals. And together, we, of course, try to partner up with interesting countries around the world and spread our knowledge and learn from them. India is indeed one of our most, prioritized countries, and because there is a great interest among our members for India. I was actually part of a delegation in 2008 that was headed by the Swedish Minister for Public Health at the time, Maria Larsson. She went with a very big delegation to India to look at opportunities for cooperation. And that was a very successful trip. I think everyone understood that this is actually a country that Sweden would benefit a lot from working with. And I think that there also was something for our counterparts in India there, because not even a year later, we had a memorandum of understanding that was signed between the governments of Sweden and India in the field of public health and healthcare. And it was signed by Minister Ramados, if I remember correctly, that visited Sweden in 2009. So since that time, we have this memorandum of understanding as a framework. There's been a strong political commitment to work together to be able to face the challenges that we have in health. And the challenges in health are global, that's for sure. And we've been reminded of that during this pandemic times, of course, that we hopefully have behind us now. We have understood also that there's a need to invest in resilient healthcare systems and also to work in new ways, in innovative ways, to be able to face many of the challenges that goes with lifestyle-related diseases like cancer, for example, and we must be able to work more with prevention, with early detection, and with efficient treatment, of course, when needed. I have two guests or panelists here with me today. I'm very proud of that. Two SweCare members. I think we start with just a small introduction of yourselves. We have, let me see here, Katarina.
Yes, thank you.
Just introduce yourself and tell us a little bit about your interesting offer and solution.
All right, of course. I'm Katarina Dalunde, and I work with something called ThermiScan. It's a smartphone-based solution with AI and thermal camera. So it's portable, easy to use, and we screen for breast cancer, pre-screen for breast cancer. So it's something you can use in the field. It's for B2B healthcare services, so it could be a nurse or a remote doctor or someone. And the thermal camera is integrated in the phone, which is super interesting right now. The technology is going fast forward.
And it is a Swedish innovation?
It's a Swedish innovation, yes.
Okay.
And with the global reach, as we say. Yeah.
Wonderful. Okay. Then I turn to you, Mohan Frick, CEO of Scandinavian Chemotech.
Thank you. And
let us hear about you and your offer.
we have developed a kind of a 180-degree technology compared to many other cancer therapies that are designed to kill or eliminate cancer tumors as quickly as possible. That's very good to do and have worked for many, many decades and probably is going to be around as well for many decades. But in some cases, we see that perhaps deleting or killing or the tumors directly very quickly might not be the best solution. So we have designed a technique that improves the uptake of chemotherapy for some drugs over 1,000 times, which means that we can reduce the level or the dose of chemotherapy to only 5% of the normal dose. Obviously, that sounds great, but the good thing as well is that we can create a programmed cell death of the tumor that is very slow progress, which means that we will reduce sufferings like getting necrotic tissue or damage of healthy tissue. And instead, we're getting our own body to work together with this process of killing them. So we're not, we don't have only the chemo as a soldier. The entire body, your immune system, is still working, and the chemo has not broken down the ability for that patient to fight its disease. And when we did that, we found really remarkable things. And we would not have done that without our collaboration with India and other countries, and especially organizations here in Sweden that helps us. And I think that's why I'm here today as well.
Really interesting. Maybe we should follow up just then and continue this discussion about sustainability. How do you see, how can you contribute to the Sustainable Development Goals, for example?
I have to be slightly frank. All these buzzwords around sustainability, there are so many that people use and organizations use. When you read about them, I think they are actually just normal approach that every individual, every entrepreneur should think about. At Chemotech, when we started our development, we didn't look at what kind of a product we have developed. Before we even developed it, we tried to find a way how we can work in a sustainable way to create global value for this innovation and product, and designed it towards that. So we don't make leaps in the development that excluding a large part of the world, or from an environmental perspective that we're using techniques that is not in favor of the nature. So I think we have to go back to the drawing board, to our engineers, and start thinking about what is the problem we would like to solve, in which part of the world we'd like to solve it, and how can we design it so we fit into that modern world with distribution availability around the world.
So you have those, in your backbone in a way, you're working.
Yeah, we have global market development, no discrimination of people, no discrimination of men or women or other sexual preferences, no discrimination of religion. This is part of what Chemotech stands for. But I believe it's most of the companies around stand for that today. But we have to design after that as well. We cannot just put it on a billboard.
It's not just words, hopefully.
Yeah. No, but yeah, if we design it, I think we can create solutions for the world as well. Like you have done with your device here. This is a typical example where you look at the problem that in global perspective, this is not, perhaps Sweden is not the biggest market for your product, right? No, because you looked at where are the needs and you designed it after that, and that's great. Congratulations.
Congratulations. So I didn't introduce you properly. You are the CMO and also a co-founder of ThermScan.
Yes.
Right? Yeah.
Yes, I am.
How do you work with this? Do you feel sustainability is something that you work with and that you think a lot of, as Mohan describes it, for Chemotech?
Of course. Health is the foundation of everything. So without good health in a population, it's really hard to achieve any other of the 17 goals. So this is, of course, very important to us. And in India, for example, I believe it's around 60% that does not live in a big city. So there's a huge difficulty with accessibility to good healthcare services. And this is something that we look into to make sure that the people that use our breast cancer screening can access it for a very cheap price, so we can make a difference really early on. Because if you're fighting for your life, it's hard to educate yourself or work or anything. So, and that's goal number 3, of course. Good health and well-being for all.
But it's fantastic to hear, I think, that you have these strong values as in the backbone for both companies. Well, one question that, of course, come up in this setting is, you have decided to go into India.
Yes.
Why India?
India is a huge market, of course, and the adoption of new technology is very interesting there if you look at it. And also, because the need is so huge with remote solutions, remote doctors, there's already a usage of these remote solutions. That's one reason. And of course, we were one of the winners of the India-Sweden Innovation Challenge, and that led us to these amazing partnerships that we have with Business Sweden, for example, and AIIMS Jodhpur in India. So, and that has led to a lot of other interesting collaborations.
Yeah, so maybe we should mention something about that. I think that is actually also one result you could say, or it's connected at least to this memorandum of understanding, that there's an innovation center established at the AIIMS, All India Institute of Medical Sciences in Jodhpur, where I think both Swedish and Indian companies can be part of it through a competition, some kind of challenge like that, and then be part of this hospital and get some guidance how their product can be used. And Mohan, what would you say, India?
AIIMS Jodhpur is one of those places where we are a technology partner to that program. We are very, very happy for the relations that our extended government, through organizations like you, Business Sweden, and also Sweden-Indian Business Council have started for us. Because in life science in India, in my perspective, it's so important to go and have the support from government institutions. Private are followers in India. They follow standards, they follow global standards or the standards of India. They are not very keen to take up new innovations or changing protocols. Those are made very much in institutes like AIIMS Jodhpur.
That's interesting. So the public sector is more open to innovative.
Absolutely. Or if you can turn it around of the coin, is that private sector is very, very, very tough to get new innovative products into. But I think it's the same globally. You know, academia is strong, and that is where protocols, I mean, the way we use the technology, that's the buzzword, we take the protocol. But it's not a protocol for, say, that you do a trial, but the protocol of how to use the technology, standardized guidelines. These are made with institutes like that. So for having Sweden's government and organizations creating these collaborations for companies like ours it means so much to us.
Okay.
And especially to reach Indian healthcare.
Well, that feedback is, of course, very good to get. But you mean that the Swedish companies can really benefit from the help and the support of embassies, I guess, and organizations that are governmental? Or
India is a very complex country with enormous amount of opportunities. But saying that, it's not a free lunch. There are no free lunches anywhere, especially not in India. You have to be long-term committed. And what is the best way to learn from those who have done it before? And organizations like yours and Business Sweden and Sweden-Indian Business Council, who have a network of already established companies who have been there for 10, 20 years. They have done the mistakes. I'm representing a small, not startup anymore, but it's still a small company. And so you. We cannot afford to make these mistakes. It's better to learn from others.
so is that, I mean, if we would give an advice to another company thinking about India, for example, what would be your best advice then?
Absolutely, to take and join these organizations. I don't think they are charging a lot for what we get. You need to be committed to India. You cannot run India from Sweden. You have to have local representatives, and you need to support them. It's not, you don't build an island and think that they're going to build a city by themselves. You have to be there to support them extensively. But if you do that, you gain the Indians' respect.
So quite a lot of investment, so to say. You have to invest your time and money, I guess, also. You need to be there and find partners.
Yeah, you can actually work. You don't have to burn that much money. You can work very locally in India with a team in one state and create that with the government, local government, RCC for me, my regional cancer center, or AIMS Jodhpur like we do there, and grow from that and establish a base of knowledge and clinical experience. And from that, afterwards, you can leverage from that to go to a new state. But think about India as a continent. It's not a continent to conquer in 1 or 2 years or 5 years. You have to be there for the rest of the corporate lifetime. That's the approach you have to have. We're going to take India. We're going to be there. We're going to help the people, whatever it takes.
You start in one state and then you can go to the next.
Yes, that's India cannot. I would say you cannot work in many states at the same time. It's going to be too much work for you.
What do you say, Katarina? What is your experience? Have it worked well, the cooperation that you have at AIMS Jodhpur? And what would be your advice to someone looking at India?
I would agree a lot with what you've said already. I think also to be patient. It's a huge country, and you need to understand the rules and regulations and take your time to make sure you're taking the right decision for where you're going, and really use the people that you have locally and the experts there.
Yeah. We actually have a third, panelist, we could call it. Earlier, we discussed with a representative of AstraZeneca, Dr. Ajay Kumar Sharma. He's Director of Governmental Affairs in India. And AstraZeneca is one, bigger company, we would say, very well known, Swedish, and we will have to say British also, I think, these days, but we're, of course, very proud of AstraZeneca in Sweden. And they're very involved in this innovation center in Jodhpur. So we are very happy to have Dr. Ajay Kumar with us, recorded though, to give his perspective on some of these issues. I think we roll that film now.
Largely around how do you get India and Sweden together on the platform where where you can get more of startups coming, more of solutions being originating from India itself. So there are so many challenges which are there in healthcare. So what we do is with India Sweden Business Council together, we have created an innovation startup challenge. So we do give them or throw away innovation challenges to the Indian startups who are tech in nature. and we look out for solutions. And if the solutions work, we definitely take it to a larger scale and we take it to even a global platform. So just to give you an idea, we started this journey with NASCOM in Bangalore. We have now moved this journey to AIMS Jodhpur and AIMS Delhi. So it's been 3 years, and we are happy to say that there are three great startups which has come out of this. Focus on SDG has been largely the SDG number three, which is all about health, and that's where AstraZeneca commits most of its time. So we are a strong proponent of universal health coverage in the country. We have already seen 50% of the population under Ayushman Bharat, but we still feel there is a large missing middle class, which is supposed to be part of that universal health coverage or Ayushman Bharat. So we are working with the government to expand the scheme of Ayushman Bharat to also include the missing middle class population, which is a substantial number, almost 500 million population in the country. That is something which we are pushing our efforts on. More than a decade, we have been also working on a program called Young Health Program. This is all about catching them young, the adolescent children, giving them all the necessary information of how could you avoid a non-communicable disease. Because India is poised to become the diabetes capital of the world, and we don't want that to happen. So we are focusing on with our Young Health Program. It's been almost 12 years. We had one center to start off with, and today we are proud to say that we have expanded into three other states. So we are now present from Delhi, that was the original city. Now we are present in Bangalore, and we are also present in Chennai. No, so absolutely. So this is a great starting point which we have been experiencing in the last 3 years. And how do we go forward from here? How does the relationship progresses? We as a company, we have a limited resource to invest. We can actually help you understand. We can do pilots in the States, both in India and in Sweden as well. We can show to the governments how these small frugal innovations can actually go a long way in solving the SDG goals or achieving the SDG goals of the country. So health is the biggest priority, and as I said, SDG 3 targets health as a key priority. If we can have early diagnosis of lung, if we can have the awareness on NCDs can be high, the awareness on cancer can be high. There are so many tools which can be developed out of this innovation startup hub. But the problem where we want is scalability. So we can get you the solution, we can prove to you the solutions work, we can get you a pilots done in a few states, but the scalability has to come from the government. I think that's where probably we would need a government to government talk. And if there are solutions which are coming out of these uh, brilliant platforms supported by Business Sweden, we would love these platforms to then be scaled up, and that is where the government support is needed.
All good things must come to an end, unfortunately. We could, I think, sit here and discuss for a long, long time, but there will be other occasions, of course. Thank you very much for being here with me. Thank you for having us. There's actually a lot going on in this field and a lot of activities that you could do if you're interested in life science, healthcare, and India. Swecare is organizing a delegation trip on, I think it's on the 28th of November already. We will visit Mumbai, New Delhi, and Jodhpur to visit this innovation center also. And we invite, of course, if there are interested companies, there's still time to join this delegation. I think it will be a very nice arrangement. It's been a while since now we could visit India, and we were, of course, very much looking forward to that now. The following week, there are other things taking place in New Delhi. I think there's a Nobel Week. We talked about that. Sweden-India Business Council arranges a lot of activities for the first time. The high-level roundtable on life science, actually. So that is, of course, also something to really look forward to, and that will take our cooperations, I think, many steps further. So please join us in this, and I hope to see you very soon again in India or in Sweden, of course. And thank you.
Thank you very much.
Thank you.
Thank you so much, Maria and Katarina, Mohan, and Dr. Ajay Kumar. Thank you so much.